544,000 tests so far. And it's worthwhile considering where we are in Australia compared with the rest of the world right now. There was another milestone, I guess, overnight or yesterday, where there is now over 3 million cases that have been diagnosed, about a third of those in the US, and over 200,000 deaths. An incredible figure when you think that the first cases we heard of were just in early January, only 4 months ago. So we're continuing to do well in Australia. We're in that suppression phase and we've certainly well and truly flattened that curve. The second thing I'd like to talk about is the importance of partnerships. We are all in this together. That's been said many times before. And there was an announcement this morning by Minister Hunt about a very exciting partnership with Twiggy Forrest, one of Australia's richest men, but he has this philanthropic organisation, Minderoo. It's named after his family farm, I understand it, in Western Australia. And he, through that foundation, has made a partnership with a Chinese company which makes PCR tests, the diagnostic test that we have been using all along, those over 500,000 tests so far in Australia. But Twiggy Forrest, through this Minderoo Foundation, has now a secure supply line. That was a problem for us some months ago when we really needed to do a lot of laboratory testing. And now he has that and has an ability to have 10 million diagnostic tests, which is a remarkable change to where we were only a few weeks ago. So those tests will be very important as we plot the way out of our current restrictions. And the Prime Minister earlier today did talk about the date that will be when some decisions will be made, May 11th. So we're on a countdown to lifting some of those restrictions. And so that laboratory testing component of the case finding ability will be a very important precedent to be able to lift those restrictions, as will indeed the low case numbers, as we're continuing to see, under 20 again in the last 24 hours. And that third precedent that has been talked about of being able to respond to outbreaks if they occur into the future. And so that laboratory testing capability will be absolutely vital to not only find cases so that they can be quarantined, but also to deal with any outbreaks as they occur. Because in this suppression phase, those outbreaks may occur, they may continue to occur, and finding them is not a failure of that particular approach, but indeed a success, because the sooner we can find those outbreaks and make them as small as possible, the smaller number of people affected, the more likely it is that we'll be able to relieve those social distancing measures. Another important component of that, and I'll stress that, and I'm sure everyone will be stressing that this aspect over the coming weeks, is the importance of the app, which was announced on the weekend. We now have over 2.8 million people in Australia have downloaded the app. That's a remarkable statistic. That's over 10%. So the more people that can download this app, the more it's going to be successful in assisting our disease detectives to find the contacts of people, of cases as they are diagnosed. The final thing I just want to talk about today is about the phase we're in. You might remember a few weeks ago, as we were on that very worrying upswing of the pandemic in Australia, where we were getting several hundred new cases of COVID-19 diagnosed every day. And at that time, there was a lot of change. A lot of new things were announced. Premiers, sometimes in different jurisdictions, announcing slightly different social distancing measures, slightly different figures and so on. And so the word confusion was used a lot then, confusing messages. And I've heard it again a lot over the last week or so. And that in one way is not surprising, because we are on a new phase in this epidemic, a much less frightening phase, but a phase of change. So over the next few weeks, and as we get closer to that May 11 target and after that as well, there will be many announcements about changes in the way that we'll be living our lives, and hopefully getting back to some sort of new normality of living in a COVID-safe society. So there'll be a lot of information. The information may be slightly different in different states. That is not a mixed message. That is a changed message, and we will, as we have always done, undertake to share those differences and share those announcements as soon as they come to be. And I'm sure across Australia people will understand that. So one example is on schools. We're all committed, I'm sure, with slightly different approaches in different jurisdictions to get the kids back into the classroom. That's a really vital thing to do for many reasons. We believe from the health side that it is safe to do so and that it is not putting teachers at risk either. But from a whole lot of other reasons, it makes sense. And I'm sure teachers, parents and children themselves will agree that that is the best place for children to be learning and to get the best outcomes from that learning. Wider than that, and we've heard from Christine Morgan, the Mental Health Commissioner today, talking about the mental health issues of this COVID crisis that we've been in. And that mental health and wellbeing component of children is really an issue, and we need to think more broadly than COVID-19 itself, but to those mental health matters for children and for their parents as we move to a more normal COVID-free society. So this is a time of very low cases. This is the time for kids to be getting back to school. So I'm happy to take questions now. Thanks.
What's your assessment, Professor Kelly, of the risk of a second wave of infections as we're seeing in some other countries like Germany and Singapore, especially as we move into winter and we look at starting to ease restrictions?
So the second wave, I'm sure, will be a topic for quite some time. In one sense, we're victims of our success there to an extent. Because we've had so few people that have been diagnosed with COVID-19 and we are nowhere near that concept of herd immunity. So that would be one way of guarding against a second wave. We're definitely not looking to do that in Australia, as some other countries have either planned to do or have been forced to achieve through very large caseloads. We've seen what that has done in other parts of the world, some of the places that you've mentioned. So we won't be going to that. A second wave is always possible, and that's why those three precedents have been set by the Prime Minister before we lift those social distancing and social isolation rules about case finding, keeping the cases low if possible. If cases occur, finding them quickly, finding their contacts, quarantining them, and decreasing the size of any outbreaks that we might have by having a very detailed and quick response. So if a second wave does occur, we'll know about it quickly and we'll respond to it. Of course, we're always looking for a vaccine to be developed. That will be some time away, but that would be the way to guard against a second wave completely.
Given the history of past pandemics, is a second wave something often harder to fight than the first wave?
Not necessarily. Certainly, if you look at past pandemics, you have to go back a ways. So thinking of the 1918 flu pandemic just after the Second World War, there were a lot of reasons why the First World War. There are a lot of reasons why that second wave was worse, which I don't think pertain to now. We are very prepared, much better prepared than we were then in relation to what might happen in a second wave. And certainly that ability to do the laboratory testing, as I said, rapidly and accurately, to be able to find cases, find their contacts, another reason to download the app, will really help us to fight a second wave. And I'm sure that there are many clinical trials going on with various treatments at the moment. So by the longer we leave that second wave into the future, the more likely it is we'll have successful treatments.
Is contact tracing capacity increased to the point where it could handle a second wave in Australia?
Yes, I believe it is. And again, I'll say the app is a good thing to download. Look, the app doesn't replace good contact tracing. We have real expertise in Australia in relation to public health broadly and including contact tracing. Every state and territory has a very good unit, and the heads of those units, the chief health officers, meet with us every day in the Australian Health Protection Committee. And in the larger states, there are public health units on a more regional basis. So that's all set up. The app is only a technological assistance to that expertise that's already there. So I'm very confident in our ability there.
Professor Kelly, with the acquisition of the 10 million tests, how many tests therefore do you hope Australia is able to do on a daily or weekly basis to be able to remove those restrictions, and therefore how long do you expect that supply will last? Will we potentially need to acquire more millions of tests in 6-12 months' time?
So I think the plan from the Minderoo Foundation was to think about using those tests in this calendar year. I do want to stress, though, that the availability of the tests is not what will drive the testing. So over the last couple of weeks, we in the Australian Health Protection Committee and here in the National Incident Room, we've been working up a very detailed surveillance plan about how we would use laboratory testing to measure what's happening out in the community, to be able to respond to outbreaks and so on. We've opened up the testing criteria now to anyone who has a respiratory illness, so coughing, shortness of breath, fever, these types of or cough, these types of symptoms. Anyone with those symptoms should be looking to get a COVID-19 test now, and expanding through that.
A number on how many you'd like to see in the Sentinel program, for example?
So the Sentinel program is part of that, and we'll be doing some cohort testing in high-risk groups as well, and that plan will go to National Cabinet, and there'll be more detail about that later in the week. But just to say that we will be expanding on testing, but we're not testing for testing's sake, as it were. So that I'm sure that's adequate supplies for what we're looking at.
Just on the Newmarch nursing home, the series of deaths that we've seen in recent days, why is it that these elderly patients are dying in hospital and they haven't been perhaps transferred to an ICU to be placed on a respirator?
So my understanding is most of them have actually died, passed away in the actual aged care facility, and I don't know the details, and I wouldn't go into the details, but I mean obviously I'm very sad for the loss of themselves and the family. But my understanding is that that was their wish, that would happen, and most of the people that have died in that and the other aged care facilities where we've had outbreaks are very elderly, and that's a decision they've made. So of course ICU, we've tripled the capacity of ICU. That's one thing we've been able to do that no other country in the world has had that opportunity, other than perhaps New Zealand, by flattening the curve to allow us to get that time to increase our capacity. So it is certainly not a capacity issue. If people would need ICU and they wanted that care, then that would have been arranged. But I'd say one other thing about Newmarch. It's an extensive outbreak, and it really demonstrates how quickly in those vulnerable groups things can change. So on a good day, as we've had in the last 24 hours, 19 cases can very quickly get into many more than that, and that's why we have to really protect those vulnerable people, but also have the testing capability to be able to find cases when they occur and hopefully prevent it getting into aged care facilities.
Are there lessons to be learned from that? Anything to be learned from that case, given that there has been such a big outbreak in Newmarch House?
Yes, certainly. People, if anyone is working in an aged care facility or a healthcare worker, really taking that even the most minor symptoms to get tested, and there's certainly not a blame game at all. The circumstances of that particular case will come out in time, but in general terms, for those of us that care for vulnerable people, really taking that seriously and thinking through getting testing early. Even the most mild symptoms can be quite infectious, as we've found in this case when we're dealing with vulnerable people.
Just back to the issue of schools, the Victorian Chief Medical Officer does seem to be giving different advice to the Premier than the AHPPC advice on schools. Are they saying different information, or what's the reason for
So Brett Sutton, the Chief Health Officer, as he is actually down in Victoria, is on our daily meetings, and we talk about this a lot. And I just go back to the first principles. The first principle one is there is very little COVID-19 circulating in the community at the moment, but it's not zero. So there is still a risk out there in the community, and I can understand the reluctance in the part of some of the states where there are more cases than others, and so Victoria is one of those. Second of all, we all agree, and we absolutely all agree, that the best place for kids to be is in the classroom when that is safe to do so. Now, Victoria will make their own decision on that basis, and Premier Andrews has talked about going a little bit slower than other states, and that's his prerogative. He's the elected representative in Victoria. So the advice is the same. The interpretation of that advice may be slightly different depending on local circumstances.
And just on the group of 8 academics talking about pushing for an elimination strategy, is it worth keeping lockdowns in place a bit longer until June so that we can actually eliminate the virus and potentially have a stronger economic recovery?
So the Group of 8 University, off their own bat, they put together a group of experts to actually come with some advice to government, and we welcome that advice. It's a very detailed report that was released, I think, today, but we've seen it a couple of days ago. Very helpful information, but in general terms, in line with what we've been advising government from the AHPPC. And in that document, they do talk about the 3 main potential strategies. One of them, herd immunity. We've talked about that already. We're not doing that one. That's essentially way too many cases, too many deaths. We decided early on that would not be Australia's way. And that leaves us with 2, the suppression strategy, which we're currently on, which means let's make a balance between the effects of COVID-19 directly on one hand and the other health, economic, social effects of the quite stringent measures that you would have to put in place to eliminate the virus altogether. So it's a balanced argument, and then look for those outbreaks and stop those quickly when and if they occur in that suppression strategy. The third one is an elimination strategy. That's something that New Zealand went down that line. Some other countries have suggested that may be where they're heading as well. When you look at where New Zealand is now, they've started to release their social distancing measures this week, which basically aligns them with where Australia is. And we have had a very similar experience in terms of the number of cases that we've had and the number of cases we're continuing to have. So we're not at this stage pursuing an elimination strategy, but we welcome the Group of 8's advice on that.
Professor Kelly, just on schools again, research released this week by the federal government by universities around the country showed that if kids are away from school for longer, it detailed a series of issues that would have for their education but also for their health. Some saying it would be detrimental to their physical health and also their mental well-being. And we're now seeing different states bring back schools in different rates, and also within certain states, say Victoria, we may soon see that a lot of the private schools come back, but the public schools remain closed until at least next term. What would be your health concern and from your medical perspective on having a disparity between the rate at which schools come back and the effect that would have in disparity in education on the children?
Yeah, so as I answered in the previous question, Victoria will have to make their own decision in relation to their schools that they run. There has been a lot of discussion about with the independent sector, the Catholic sector as well, about that, and there is federal funding that goes to those schools, so we have some influence there. Look, as I said before, I think everyone agrees that the best place for kids, for all sorts of reasons, their educational outcome, their mental health and well-being, their social development, their physical development, the best place for them to be during those school years is in the classroom and being with their friends and getting the best outcomes. And we believe from a health perspective that is now safe for that to occur. Different states will make their own decisions in relation to their own schools that they run. Victoria is a little bit different from others, and ACT is a bit different from others as well. Have you got a question there?
Just got one from Nick Callan, 27.
Yeah. Hi, Nick.
Professor, thank you for this. I just wanted to know how closely your office, the Federal Medical Office, is working with the AFL in particular and the NRL in helping them jump through all the hoops to make sure they can get their competition back up and running. Are you working very closely with them?
Yes, we are working with the AFL, the NRL and other codes and specifically with the Australian Institute of Sport, who's done, a very great thank you to Dr David Hughes, who's done excellent work with a team there at AIS to look more broadly, not just at the elite level of sport, but to community sport and Olympic sports and so on, about what would be a safe transition back to sporting codes, including the elite ones, AFL, NRL and others. So we had a detailed discussion about that today in AHPPC, and there will be advice going to the National Cabinet on Friday with some general principles and some advice on those matters. Oh, sorry, Nick, one more question? Yeah.
Yeah, and how important is I suppose the opening of the interstate borders, specifically with the AFL, how important is the opening of the interstate borders, and what are you advising on that at the moment?
Well, both the AFL and the NRL and other codes, so netball would be the same, and the rugby union and other sporting organisations at the elite level are national competitions, and so or at least several states involved. So those internal borders in Australia will be an issue that will have to be dealt with in relation to that. As it stands at the moment, if the Dockers, my team, came over from WA to play at the MCG or wherever a crowd-free event may occur, when they went back to WA, they would have to serve 2 weeks of quarantine, and so that would be difficult. So I think there'll obviously have to be discussions at the state level about those matters if these competitions were to proceed.
Professor Kelly, the Prime Minister said today that while international travel was a long way off, he hoped there would be a point where Australians could travel within the country. In terms of the contact tracing capacity, are you confident in other measures in place for potentially interstate sharing of information so that if someone is travelling or on holiday in another jurisdiction, that contact tracing can still happen as quickly?
So it's a very good question. So that happens now. We some years ago developed a legal framework of data sharing between states in relation to infectious disease outbreaks, and so those same things would pertain wherever that information about contacts came from, whether it was from the app or from the more traditional way of asking those questions. So on a very specific way that would occur if I was in Queensland and I became a contact of a case in Queensland and I had the app, as I do, and I hope all you do, and the contacts also had the app, then that information would go to Queensland as the place where the case was, with that contact information, including my mobile phone number, and I would be contacted.
Professor Kelly, there's a bit of a push on in the United States to develop a kind of a permanent pandemic department, even maybe a secretary of pandemic, etc. The minister this morning said that we do have a permanent pandemic body in Australia already. Could you just give us a little bit more information on what that permanent pandemic kind of agency is?
So it's the Australian Health Protection Committee that you've heard of a lot. I'm a member. It's chaired by Brendan Murphy, the Chief Medical Officer, has the Chief Health Officers of all of the states and territories. And under that committee there is a range of other expert committees that give detailed and very specific advice to that committee. So that's the standing committee. We have that all the time.
Need for kind of a permanent pandemic body, basically, we've already got that infrastructure here.
Yes, I believe we do. There have been calls in the past to set up something like the CDC or Centres for Disease Control in Australia, so that we can be like the US. I think it's interesting that the US is now talking about setting up something which they've already got. So I think we have that structure at the federal level, and it's mirrored in each of the states and territories. There is expertise in each of the states and territories, and we have a virtual centre, if you like. Yeah.
Okay, just back on the NRL. Sorry. I'm back on the NRL.
Okay.
But there's just a lot of confusion as to how realistic it is for So can you give us any indication about what the committee you sit on has been thinking regarding, like, can the game start up again in a safe way? Is that realistic?
So I'm not going to preempt the discussion that will happen at National Cabinet on Friday, but there were a range of there's a framework that we've developed which I think can work for community sport and for the other codes. The elite level will have to think of specific other things related to, for example, if they had someone who did become COVID positive in a team, having had an extremely contact sport engagement during the time of infectivity, and NRL, or both NRL and AFL, both are contact sports. So that would be an issue for the sport itself in terms of what would happen for that team or the team that they played. So those are specific issues, but in a general sense, what we would need to work through with the codes and with anywhere that sport was being recommenced is to have a very detailed plan about that and hygiene measures and so forth to minimise any problems.
Are you talking directly to the codes, the chief medical officers and committee?
So yes, I haven't spoken to all of the codes. I did speak to one of the CEOs in recent days, but other members of the committee have spoken directly with the other codes.
Just briefly, do you have updated numbers on hospital admissions and ICU?
Yes, I think I do. Let me just see. So hospitalised, and this is as of this morning, so it would be slightly updated now, but it's 104 total hospitalised as of this morning, 40 of those in ICU and 26 in intensive care with ventilation. So well below the 7,000 limit.
Yep. Yeah, I'd love to if that's possible.
Sure.
Kelly, the World Health Organization last week came out and said that there was no evidence that people couldn't catch the virus twice. But I understand that some people who have left South Australian borders have been told that if they've already had coronavirus and they come back into the state, that they're not required to do the mandatory 2 weeks of self-isolation. What's the understanding in Australia about this at the moment? Because that seems to somewhat contradict what the World Health Organization has said.
So the World Health Organization came out with a couple of statements which were slightly contradictory last week. So the one you mentioned, but also that they were commenting on this concept of an immune passport. So they also said that there was no strong evidence yet of long-term immunity after you've had a case of the virus. So those two things are still uncertainties about COVID-19, and we're continuing to learn things every day. But in terms of South Australia's own stance, you'd need to ask them about that. I'm not sure how they work their quarantine.
What's the AHPPC advice?
That's the Deputy Chief Medical Officer, Paul Kelly, with an update on Australia's COVID-19 outbreak and response. We can talk now to the person who facilitated the purchase of an additional 10 million coronavirus test kits, as well as some pathology equipment that Dr Kelly was talking about in that update. Mining giant Andrew Twiggy Forrest used contacts in China to obtain the medical supplies. His philanthropic organisation Minderoo Foundation paid for the equipment, but the federal government will repay the cost over time. Andrew Forrest joins me now. Welcome.